So the difference between Botox and fillers, this is a question I get asked about all the time. So I thought it'd be really useful to put this out here so you could all have a little look at the reasons why sometimes I might suggest Botox as a treatment for you as opposed to filler. So essentially, botulinum toxin, or Botox, which is actually one of the brand names, is a toxin which is used to actually relax the muscle. So it actually stops the muscle from contracting. So as we age, we get more wrinkles, and those wrinkles happen because our muscles are working all the time. So we'll find that when we are young, even children, their faces wrinkle when they move, and this is called dynamic lines. But we find that when they relax and their face is at rest, they don't have any lines. As we age, those lines stay, and that's what we know as static lines. So there are different things we can do. We can prevent lines from getting deeper by treating with Botox. So by injecting Botox and stopping that muscle from contracting, we'll actually find that we won't deepen those lines any further. So that's a really good way, and that's a really useful way of helping lines like the crow's feet, for example, around the eyes, or the classic 11s that you get between the eyes, or the lines that are horizontal across the forehead. So Botox works really well to help soften those lines. People often then ask me why it hasn't gone away straight away. So they have the Botox, and then, a few weeks later, they might contact me and say, well, my lines are still there. So remember, Botox will actually stop that muscle from working, but it's been working for 30 plus years before you have this treatment. So one treatment of Botox is not going to get rid of those lines. However, I am confident, and I can tell you that over repeated exposure and having repeated Botox every 12 weeks, that muscle, because it's not working, will mean that the lines will get soften and more so, and become less and less obvious. So the one treatment is not going to reverse 30-something years of aging. When we come on to fillers, fillers basically replace volume. So as we age, we lose volume in our face, most noticeably in the mid-face, which is here. So you'll notice that when we're young, we have a triangular face. So we have a nice pointed chin, and most of our definition is here in our cheekbones. As we age, the face becomes more square because we lose volume here, which then causes our jowls to drop and less definition in the jawline. So when patients come to see me and they've got lines from here to here, called the nasolabial lines, or they've got lines at the base of their lips, called the marionette lines, or indeed they may have jowls, they will then wonder why I don't just recommend filling in those little lines. The reason I don't just fill them in, it's almost like thinking about a crack in a wall. If you have a crack in a wall and you just paint over it, that crack's going to reappear. If you put polyfiller in the crack and correct it before you paint it, it's going to stay away. So we need to think, rather than treating the line, we need to treat the reason for the line. And the reason we get that line is because of the mid-face volume loss. So what I need to do is replace the volume here in the cheeks, which will then lift the whole of the lower face, thus by minimising the lines from nose to mouth and the lines around and below the mouth. So that's why you may come thinking you're going to have one treatment, and I may suggest something that may sound completely bizarre to you, but there is a reason for this, and the reason is that I want to give you the best possible outcome. And very often that's about thinking about the foundation and the reason why you're developing those lines and how our face ages as we get older.